Hi everyone, my name is Dr. Lisa. I'm a dentist from Australia, and today I would like to show everyone all the weird and interesting things that we do in your mouth when we are doing fillings in your teeth. So if you like to come closer, I'd just like to show you a few things. So after we have finished drilling your teeth and removed all the decay, we will start the filling process. And if the cavity involves more than one surfaces, then we need to use something called matrices. Or if you would like to have a look here in this drawer, this is where we keep all our matrix bands, that's what we call it. So what matrix bands do is that they help to shape the filling. So for example, if the cavity involves a surface in between the teeth, so where teeth sit against each other, then we put a metal band like this in between your teeth. Okay, so they come in different sizes. So that's a small, and then we have a medium and large and extra large. So they all come in different shapes. So like that. So if the cavity is very deep, then we will use something like this. And then we put a clamp like this on your tooth to keep the band in place. Okay, so these are called sectional matrices, and this is just a holder to hold this clamp. And after we put the matrix band down, we will put something called a wedge in between the teeth, which also help to shape the filling so that we don't get any overhangs, and also keep the band in place. Okay, so they also come in different shapes and sizes, and they're also different material ones, so wooden ones and plastic ones. And if the cavity involves more than two surfaces, then we will use bands like this. So if it involves both the front and the back of the tooth, then we will use something like this. This is called an auto matrix. Okay, so we also have matrices like this. This is called a tophomize. So this is the holder, and this is the band. So we actually will put this band inside this holder, and then we'll put it on your tooth. So after the filling is finished, we actually remove all of these so nothing stays in your mouth or in your teeth. Okay, so after we put the matrix bands on, we will start to treat the tooth surface to prepare it for the filling material. So the first thing we do is use this blue gel. This is called Edge, so it is phosphoric acid, sorry. And what this does, is that it roughens the surface of our enamel. So once the surface is roughened, then we get an increase of surface area, which increases the area of bonding. So there's more surface area for the filling material to stick onto, so that it is stronger, it wouldn't just come away from the tooth. So it comes out of the syringe like this, so it's just like a blue gel. Okay, so this is just a delivery system. We don't poke this into your tooth or anything like that. It just looks a little bit dangerous, but it's not at all. Okay, so we leave this on the surface of the enamel for about 20 seconds, and we wash away with water. After that is done, then we apply a very flowable type of resin glue. Okay, so we just brush it on with a little brush like this. This is called a micro brush. So this acts as the glue, and then we will shine light onto the glue to make it really, really sticky, so that it's no longer liquid. So what we do is just like this. So we just shine light on where I painted the glue. So a lot of people are wondering what this is. This is just a very strong LED light, and this is just to protect our eyes. So there is no UV or any sort of radiation involved with this. Okay, so it's just very strong light, because resin is light cured, so light makes it go hard. Okay, all right, so after we paint the glue on, then we'll start to put the filling material or the composite resin material in layer by layer. So the composite resin, they come in this is what we call sausages, like this. So we squeeze a little bit out, just to show you guys what the consistency is like. Okay, so you can see it's very pliable, It's like Play-Doh, okay? So I can shape it into whatever shape I want, you know? So like this, okay? And after I have shaped it into the desired shape, let's just do a sausage as a example, okay? Let's shine some light onto it. So for about 10 seconds. So usually we light cure for 10 to 20 seconds, depending on the thickness. So it has had 10 seconds of light. Have a look. It's gone hard. Okay, see, I can no longer bend it. It's no longer pliable. Okay, so this will replace the tooth structure that you have lost due to decay. Okay, and they also come in capsules like these. So we put these capsules in composite guns. This is what we call the gun. And we take this little cap off and we squeeze it and it comes out. Okay, so I don't want to waste any material, so I just this is just to demonstrate what these all look like. Okay, so with the composite resin material, we layer them down layer by layer. So if your hole was this big, we actually put in, you know, sections of it like this size and then that size, and layer them until they fill your entire hole. The reason we do this is because composite resin has about a 3% shrinkage when it is light cured. So if we put in a whole bulk in one go, you receive a lot of shrinkage, and because it sticks onto your tooth structure, it can put a lot of stress, internal stress on your teeth, and that can also cause cracks. Girls who do gel nails will probably know a little bit more about this, because gel nails is very similar to well, the light curing properties is very similar to the composite resin. So when they put the gel on your nails and they cure it, you can feel that hot tingling sensation, and a lot of that is coming from the shrinkage of the material. Okay, so I hope this has cleared up all the weird things that we do in your mouth. So thank you for watching. See you next time. Bye bye.